what you described about a white person and a black person having the same experience, yet the early and therapeutic intervention is given to the white person.
Of course.
But the black person actually
We
goes
see
on a bit
differently.
longer, gets to a point where the intervention has to be high and hard or not at all. And that's described in the research. So so that's one of the open wounds to me, that that the discourse that's around for people to get help, men in particular, black men, they struggle in the health service.
There's a stereotype that happens with black people when they present, and particularly, a young black man would present, and people have these preconceived ideas about young black people. The person who presents with mental health, say, there's also a presumption that happens there. And sometimes people who are offering care and support, they don't necessarily know what they don't know, and therefore they may be well-intentioned, but the service and the training they have had just isn't fit for purpose for our community. Black people, we are diverse. So you have the African experience, the Caribbean experience, and all the others in between. What supports one necessarily supports another. With CAMS, I know of some people, young people, who have had terrible experiences in CAMS. I know of some LGBTQIA young people who say they have just met with prejudice when they've been, they've gone to use CAMS services. Some of the younger people who have come in as refugees and asylum seekers, their experiences with CAMS have been terrible. Now that they're adults, they are finding the adult services much more accommodating to them. But some of the things that we actually see in community is where, as he said, the blackness more empathetic. So they are aware because they understand better, not all, some understand better, they see it in community. And I'll give you an example. Many years ago, someone that we were working with, I was working on call, someone who was working in our community, she was sectioned. And we found it very strange, she was sectioned, African woman, and what it was, she was, I don't know if they still do it, but she threw the packet of rice in a tray to pick out, the bits of black rice grains, etc. Singing praises to God. She was doing it outside, she does it every Sunday, and the neighbors thought that was something odd, she was talking to rice. What happened was the neighbors shouted at her. She started to become aggressive. They then said that she was a threat to herself and others. All she was doing was singing praises. It was Sunday, picking the bits of thing out of the rice. Cultural misinterpretation there. And she was actually put into mental health service. So it is not just about the empathy, it's understanding cultural nuances and having cultural sensitivities.
And I've also seen a change now. Maybe the pandemic did us some favour in actually increasing diversity.
Okay.
Because we actually had an investigation in our oncology department to say you need to increase diversity because our women reported it. Yeah. And it was actually a black matron that did the investigations, and things are changing. But I have seen many things, particularly, things like lymphedema. Lymphedema is damage to the glands when you have an operation. Some people are born with it, that's primary lymphedema, and then you get secondary lymphedema. But I was meeting black women who were actually NHS nurses and had had lots and lots of glands taken out when, you can do that thing where you look for the sentinel node and put blue dye through it. And really not being explained why they'd had so many glands taken out, and one had lymphedema that was right across the shoulder and everything. And having to explain to them that, you need to get information, accurate information, and ask questions and whatever. And in the end, my own consultant said, we kind of need advocates because a lot of people aren't really understanding in our communities. And so we did a 12-month project with the charity. But, to keep that going, we've had to wait another year, basically. The project ended, you can't afford, we kept on doing it, but we're doing it for free, basically.
The reason people don't like to come into cancer is it's very emotive. There are a lot of myths out there about cancer, and I've met a patient whose family thought they could catch cancer and they totally disowned it. And trying to educate them about that it wouldn't happen like that and they'd be okay. But that took about 2 years to try and get all that, and in the middle of that, trying to get that patient through it. And she was grateful that I was there as a black person to be able to understand what was happening, because my colleagues couldn't understand it. They couldn't understand where this myth came from and why were people still perpetuating this myth. But I think having the same culture as them, or similar, what's they saying, it gives you a sounding board to help that patient. Now, you know, as a BAME cancer patient, that 20, 30 years ago, all the prostheses, if you had a mastectomy, were white. There were no, now you can get skin flesh colour, you can get brown ones, but we had to go to America to get those. And we had patients who had to advocate to get something that everyone else was getting.
Even things like reclaiming my hair after, at the moment, I haven't got my Afro wig on. This is the first time I've been able to claim an NHS voucher and go pay for an Afro wig from a black hairdresser. Well, I left the service in 2003, we've done a lot of work there. I've been qualified since '76. And there were services beginning to happen in London, but then I went back to Nottingham. And when my sister was diagnosed, she went to a service that's called Look Good Feel Better, and lots of people, businesses give products to them. And my twin sister was just more like my mother. She was slightly lighter skinned than me, and she had freckles and whatever. So she thought, you know, they were going to give her makeup that was the colour of her skin, and they only had white makeup. And she had to sit out the session, and in the end they gave her a bag of white makeup. And I campaigned for that to change, and now we do have black makeup in Nottingham, but I know there are many Look Good Feel Betters that probably don't. And actually I've never seen a black woman be the model for actually learning how to do your makeup.
All these things, you know, is about cooking the right food, but being able to find the right food. And the right food isn't what they tell you in a diabetic clinic, you know. So I'm very good at bidding any menu things that they give me, because it doesn't reflect me. Only now they have pictures of somebody that looks like you.
Yes.
But years gone by,
that wasn't the case.
That wasn't the case.
Yes.
You know.
Yeah. So it's about cultural competence and cultural sensitivity. That's so important. Even to Asian people, one might be Hindu, one might be Muslim, one might be Sikh. They will have differences in terms of their dietary needs. They mustn't have this homogeneous thing about, well, it's all black people, you're all going to eat the same food. No, the person from Trinidad might have different types of food than what the person from Africa does and the person from Jamaica. So when you go to the healthcare professionals within the NHS, they can't just give you this generic thing and say, oh, we'll go and look at this, that, and the other. And you say, excuse me, I don't eat any of those type of foods. It's as simple and basic and fundamental as that. And if you can't get that right, then you might as well close up shop and go home.
When Trevor Phillips was a GLA member in London, he was actually chair of the GLA for a short while. He chaired a sickle cell committee, which I was a member of, and he was close friends with Alan Milburn. I think they might have gone to university together or something like that. And he was, to be fair to Trevor, he was really active trying to promote the whole issue around sickle cell. How we could get better screening, I'm talking about 20 odd years ago now, how can we get better screening of people around from prenatal all the way. And the only time that people knew about someone's sickle cell, when they presented late. How can you get screening at an earlier stage? And the best way is when women are pregnant, they use the screening test. So what Trevor did, he said to Alan, we've got the data, but I'm telling you as a friend, we need to do this. And Alan Milburn put an NHS plan, and then became law, and now today, every single mother has a sickle cell test. And that is why now we have a situation that we've got more and more young people have found that they've got sickle cell at an earlier stage, but unfortunately what we need to do now is to make sure that the services are meeting their needs. Because now we know there's a bigger pool of people with sickle cell because we're doing early detection. Now we've got the data, we've got the evidence to demonstrate there's now a whole pool of people of different ages, many of African Caribbean background, but yet they are still treated third-class citizens around healthcare, despite the fact there's the clear evidence base around their needs, what their conditions are, what works for them, and there are a number of user groups articulating those stories. And we just heard from one young man about his own experience, that he has this fear of trepidation going to hospital because he's not quite sure whether he'll be respected or not. We've got the data. We can change sickle cell. That's one example that we could do right now. We've got the evidence, we've got the data, we can put it on the same status. I mean, people talked about parity of esteem back in the day around physical and mental health. There needs to be parity of esteem for black people's health care. That's what we need to talk about now.